Hi everyone, my name is Madison and I'm an undergraduate student here at UCCS studying biochemistry.
I'm a former UCCS student and currently a post-bac research fellow working in Bethesda, Maryland, and my name is Cody Stein.
Hi, I'm James Kovacs and I'm an assistant professor in the Department of Chemistry and Biochemistry at UCCS. I think maybe the first thing to get out of the way is to know the difference between the name of the virus and the illness that it causes. So I'm sure many of you have heard COVID-19 thrown around a lot. COVID-19 is the actual illness that is caused by the virus. The virus itself is the SARS coronavirus 2, or abbreviated SARS-CoV-2. The moniker of a coronavirus came from the first viewing of this virus under an electron microscope. And what the researchers noticed is that surrounding the surface of the virus, so this is a spherical virus, there were projections that made it look like a crown, hence coronavirus, the name corona came about. And it's those projections that are known as spike proteins that do the physical docking with the host cells and the host proteins.
There's a few different coronaviruses that we've all kind of familiarized ourselves with. The first and the most common one that almost everybody has seen is just the common cold symptoms. But the most closely related coronavirus was actually SARS. So you may remember that from the 90s when it broke out. And SARS and the new coronavirus are very similar, and they even use the same receptor on human cells in order to get into your body. But where SARS was less infectious and more deadly, this new coronavirus appears to be less deadly but more infectious.
That's a great question. What we understand currently about the coronavirus family is that these viruses do not mutate nearly as rapidly as influenza does. And so the idea of going after making a vaccine against this coronavirus strain is a very appetizing plan, because it does not mutate nearly as much. And that is actually one of the hallmarks of the coronavirus family.
Vaccines help develop immunity by imitating an infection caused by a virus. And while this type of infection never really causes an illness, it does help your immune system produce antibodies, which increases the immunity in your body. So basically, if you get a vaccine, then your body learns to fight off that infection caused by that virus. And part of the reason why we get a virus year after year is because of some mutations caused in certain viruses. So that's why we have to continuously build up our antibodies in order to keep up our immunity. According to the CDC.gov website, here are some symptoms that you should watch out for. So as the website states, symptoms may appear 2 to 14 days after exposure to the virus, so you may not know if you have it until after a certain period of time. Symptoms include cough, shortness of breath or difficulty breathing, fever, chills, muscle pain, a sore throat, and new loss of taste or smell. While those may seem very similar to a flu or a cold, it is very important that if you have these symptoms to go get tested. But we do ask that before you decide to show up at your local medical testing center that you do call ahead so that they can properly prepare to have you tested. Finally, we want you guys to know that there are plenty of resources that are available to the public during this pandemic and this current time. And if you would like to be more educated and learn more about the coronavirus yourself and perhaps even test yourself for symptoms, here are some resources that we found that would be very helpful for you guys to look at. So the first one is the Apple/CDC COVID-19 screening tool. This is a great resource to screen yourself or a family member.
So the next resource we have is the Johns Hopkins coronavirus tracking site. And here you can see all the information such as total confirmed cases around the world, as well as total global deaths. And you can also look at other graphs based on time of the number of positive cases per day, and or the cumulative positive cases per day. And you can also break this down by country. So you can look at the United States, you can look at the United Kingdom, and other countries that are under heavy lockdowns, such as Spain and Italy, where you can see that they appear to be reaching a total maximum of number of cases per day right now, as their amount of new cases seems to be flattening. And then the last one that we have here is a CDC website of common chemical disinfectants, as well as how they work, so their mode of action, and what the current literature says on how they destroy viruses as well as bacteria. And this includes everything from alcohol to bleach. You can see there's a whole bunch of them here, but it may be a good resource to look for when you're looking at ingredients on the back of cleaning bottles in the stores, if you can find any, of course.
We hope that by addressing some common questions that we've received from students, faculty, and staff at the University of Colorado, Colorado Springs, that we're able to inform you a little bit more and give you some resources as well to continue to educate yourself about the pandemic and these interesting times that we're all living in.